The patient needs to be empowered, as the statement is often heard. Okay, but what does empowerment really mean in a patient-doctor relationship? A doctor is considered a powerful person. Usually the person possessing power can make other people do things even if they don't want to do them. Thankfully, this is not the case in an average patient-doctor relationship. In fact, patients do not have to do anything if they don't want to. But the doctor's power is still there. How come? Well, according to Emerson's resource dependency theory, power is all about the dependence on resources. Researcher Edvard Eggman applied this to healthcare. The patients come to the doctor seeking help. They depend on the doctor's resources, such as information, knowledge, skills, time, affection, and attachment. And finally, on his legal right to label a disease or prescribe medication and sick leave. The more important these resources are to the patient, the more powerful it makes the doctor. So from the very beginning, patients find themselves in a situation of dependence. They're sick and often vulnerable. Let's face it, most people wouldn't go to the doctors if they were able to resolve their problems without them. Moreover, if patients are uncertain or afraid of what they have, they may depend on the doctor's resources even more and feel a loss of control. Of course, doctors also depend on patients' resources. For income, they need patients, and to provide a diagnosis and an effective treatment, they need their patients' information. Eggman's study concludes that the resource power of doctors by far outbalances the resource power of their patients. Let's be honest, most people prefer to keep control over their lives, no matter the circumstances. The feeling of losing control and being dependent can make them unhappy and sick. And here the concept of patient empowerment comes in. It means giving patients control, or a feeling of control over their health and healthcare. This is the key to patient empowerment. It means that the doctors transfer the control over their resources, like information, knowledge, and time, to their patients, which empowers them. The doctors also make sure their patients have a feeling of control related to the resources they remain dependent on, by communicating in an open, egalitarian, and respectful way. If you want to know more on resource power in healthcare and Edvard Eggman's research study, go to www.patientempowerment.be.